Magnesium is the fourth most abundant nutrient in our body. It is involved in more than 600 chemical reactions in our body, from DNA synthesis to muscle contraction. The optimal magnesium level is essential to maintain the proper functioning of the brain, maintaining a healthy heartbeat, and regulate muscle contraction. Magnesium deficiency is also known as hypomagnesemia and is often an overlooked health problem. It has been estimated that nearly 70% of Americans are not meeting the recommended daily intake. Today's video will talk about 13 indicators of magnesium deficiency to help you understand that you might be deficient in it. So, let's get started. Number 1. Muscle cramps and twitches. Ever suddenly get a leg cramp that won't let up, or wonder why your eyes just won't stop twitching? It could be a sign that you are deficient in magnesium. This mineral plays a key role in healthy neuromuscular signals and muscle contractions. So, if you are deficient, these types of muscle abnormalities may occur. Restless leg syndrome is another warning sign of magnesium deficiency. If you want to overcome your muscle soreness, leg cramps, and restless leg syndrome, you must increase your magnesium and potassium intake. Magnesium deficiency can also result in accumulation of lactic acid in the tissues, causing muscle pain and tightness. Taking magnesium can help relieve pain and soreness as it helps to alkalize the body and keep healthy pH levels in check. Number 2. Calcification of arteries. For years, we have heard, make sure you get your calcium. But if you are taking calcium supplements without magnesium, you may lead to magnesium deficiency. Research has shown that taking calcium alone can reduce the amount of magnesium you absorb. Magnesium presence is also required for calcium to be absorbed into your bones. If that's not enough, excessive calcium may build up in your arteries, leading to a disease called arterial calcification, otherwise known as hardening of the arteries. So you can say that increasing the daily magnesium intake can improve the way the body uses calcium and prevent the onset of cardiovascular disease. Number 3. Irregular heartbeat. In the case of the most severe magnesium deficiency, it can lead to heart arrhythmia or irregular heartbeat. The symptoms of arrhythmia are mild in most cases, but in some people, it may cause heart palpitations, which are pauses between heartbeats. Arrhythmia may increase the risk of stroke or heart failure. Magnesium helps to adjust the cellular levels of minerals like calcium and potassium. Interestingly, these two minerals play a significant role in the contractions of heart muscles for proper blood circulation. Hence, inadequate magnesium in the body can indirectly result in heart tissues like arrhythmia. Number 4. High blood pressure. Magnesium deficiency increases the risk of heart disease by promoting high blood pressure. This mineral helps prevent the constriction of blood vessels, which can increase blood pressure. Since hypertension is the cause of 50% of all ischemic strokes, it's best to practice preventive medicine and get your magnesium. A study published in the American Journal of Clinical Nutrition found that a diet rich in magnesium may reduce the risk of a stroke by 8%. Another study found that when people with heart disease take magnesium twice a day for 6 months, they had better physical stamina and healthier blood vessels. Number 5. Weak bones or osteoporosis. As mentioned earlier, magnesium regulates calcium levels for optimal bone density. But due to a lack of magnesium, one might experience low calcium levels, which can in turn result in poor bone density and, consequently, multiple bone fractures. Osteoporosis is a disease that affects the bones and makes them weak. A study carried out in 2013 indicated that magnesium is a crucial factor in bone health. If you are finding this information useful, please like this video, subscribe to our channel, and hit the bell notification button to stay updated on our latest health and nutritional tips. Number 6. Headaches and migraines. Anything between having a slight tension in your head to having severe migraine headaches can result from magnesium deficiency. Because one of the cellular functions of magnesium is to relax your muscles by controlling the calcium levels within your nerve cells. According to research, low magnesium levels are one of the causes of headaches. Increasing your magnesium intake through supplements or diet may help reduce migraines. Number 7. Insomnia. Factors like anxiety, depression, and mental stress can keep you awake all night. However, if you are trying every possible means to get some sleep to no avail, then you should check your magnesium level. Insomnia can cause nerve damage as it will lead to exhaustion. Taking magnesium helps you relax and sleep better. Magnesium can control melatonin production, which is the hormone that regulates your body's wake and sleep rhythm. It also interacts with gamma-aminobutyric receptors, as it helps relax nerve activities that influence sleep. Number 8. Digestive issues. Did you know that it is impossible to digest a meal without magnesium? Lack of magnesium in your body will lead to abdominal cramps, bloating, less bowel movement, and excessive gas. Magnesium also acts as a stool softener, preventing constipation. Magnesium pulls water into the intestines, which helps to ease and enlarge the size of the stool, which helps to have an easier passaging of stool. Number 9. Fatigue and muscle weakness. Fatigue is characterized by weakness, or physical or mental exhaustion. Fatigue may be simply due to working long hours or not sleeping properly. But if the fatigue is persistent or severe, it may be a sign of a health problem. Another specific sign of magnesium deficiency is muscle weakness, also known as myasthenia. Scientists believe that the weakness is caused by the loss of potassium in muscle cells, a condition associated with magnesium deficiency. Therefore, magnesium deficiency is one possible cause of fatigue or weakness. Number 10. You suffer from premenstrual syndrome, or PMS. Research has shown that women with PMS symptoms have lower magnesium levels than those without PMS. Magnesium deficiency has even been linked to a variety of other women's health issues, including hormone imbalance, cramping, mood swings, migraines, low energy, and bone disorders. Number 11. You are pre-diabetic or have type 2 diabetes. Magnesium plays an important role in the way your body metabolizes sugar. Magnesium aids in the activity and release of insulin and in maintaining healthy blood glucose levels. Low magnesium levels may make insulin resistance worse, which is a condition that develops before it proceeds to type 2 diabetes. Diets rich in magnesium have been shown to lower the risk of type 2 diabetes significantly. Studies have found that taking just 100 milligrams of magnesium per day may reduce the risk of diabetes by 15%. Number 12. Mental health disorders. Another possible consequence of magnesium deficiency is mental health disorders. These include apathy, characterized by a lack of emotion or mental numbness. And if the deficiency is worse, it may even lead to delirium and coma. Additionally, studies have found that the low magnesium levels are associated with an increased risk of depression and anxiety. Number 13. Asthma. Lack of magnesium can cause the buildup of calcium in the muscles lining in the lungs' airways, which causes the constriction of airways, making breathing more difficult. That is why inhalers with magnesium sulfate are sometimes given to people with severe asthma to help relax and expand the airways. Scientists believe severe asthma may be a symptom of magnesium deficiency in some people, but further studies are needed to investigate its role.